Hey guys, this is Dr. Wong with PhysioU with your Mentoring Minutes. And this week I want to talk to you a little bit about prognostic factors that will help you decide if patients are going to fare well after their rotator cuff surgery or not. And we know that a large population is going to suffer from rotator cuff tendon problems, particularly in this region, right? 13% of people aged 50 years and older will likely have some type of rotator cuff pathology, and up to 50% in the groups 80 and older, and we are seeing a much older population coming into the clinic now. We want to know what are the factors that help you to determine whether a patient is going to get better well after their surgery, and which are the factors that will make it hard for them to not get better. So today's Mentoring Minutes is all about the prognostic factors. This is the Vermont et al. Article from 2014 in JOSPT talking about these variables. All right, so this is the Vermont et al. Article from 2014 in JOSPT, and we are looking at prognostic factors for successful recovery after arthroscopic rotator cuff repair, a systematic literature review. How do we take all this work by this team, scouring the literature, and make it clinically useful for us? So you are, as a clinician, trying to make a decision about these common patients that we're seeing post-rotator cuff repair, and you're wondering, can you begin to predict who are people who will do well in rehab? So they broke it down into four main categories: demographic factors, clinical factors, factors related to cuff integrity, and factors related to the surgical procedure. So the demographic factors, they found, of course, that the younger the age and the male population seem to respond better to the surgery and enjoy a better quality of life. The older we are, the less well that the healing occurs. And being female seems to predict that the patient will have a poorer quality of life. Some clinical factors: higher bone mineral density, which typically means that patients who have good bones will also have good anchoring of the rotator cuff repair. Absence of diabetes mellitus. Higher levels of sports activity seem to predict a higher quality of life after the repair. And greater preoperative range of motion, which might speak to how important it is from a pre-surgery rehabilitation, where we are helping to make sure that the patients have good range of motion before they go in. And the absence of obesity. Factors related to cuff integrity: if there's a smaller sagittal size of the cuff lesion, the patient tends to do better, and less retraction of the cuff, which often implies that the sooner the patient gets into surgery, the better. Less fatty infiltration also predicts better outcomes for these patients. Again, this likely results in a delayed referral or delayed surgery where the tendon has become much more degenerative. And finally, no multiple tendon involvement. Factors related to the surgical procedure: when there is no concomitant biceps or acromioclavicular joint procedures, the patient seems to do better. So that sums it up for this Mentoring Minutes. That gives you a good picture of the types of patients who will do well with surgery.